Hello, friends. Are you taking one of these over-the-counter medications, maybe even every single day, without even knowing that it definitely increases your risk of getting Alzheimer's or dementia? I know when I saw the report, I was very concerned. Hi, everybody. I'm Dr. Becky of Dr. Becky's Better Brain Tips, and a research article was published at the end of 2024, and I recently came upon it, and the information was so important that I knew I needed to do a video on it. And it might even be sort of a long video for me, so you might want to hit pause now, go make some popcorn, and then come back, because there's a whole lot of ground to cover. And part of what I'm going to share with you today, you likely already know, because I've done a video on one component of what I'm going to talk about today. But this report that came out in 2024 shed a light on a whole lot of very common over-the-counter medicines that people take, and some people take every single solitary day. And these medications increase your risk of getting Alzheimer's or dementia. And I would venture to guess that you wouldn't on purpose do something that would increase your risk of Alzheimer's or dementia. So let's talk about what the types of medications are and what might be done to minimize your risk of getting Alzheimer's or dementia. So the one video that I've talked about before covered a class of drugs that's called anticholinergic drugs. And again, I'm going to link in the show notes that YouTube video that I've already done. And anticholinergic drugs are a class of drugs that stop the production of acetylcholine. And acetylcholine is a really important neurotransmitter that's responsible for cognitive function and for memory and the retention of memory. And there are a myriad of drugs, over-the-counter drugs, that are anticholinergic, and we'll cover those in a minute. But again, what this research article in 2024 covered was that not only do anticholinergic drugs increase your risk of Alzheimer's or dementia, but antihistamines also increase your risk. Omeprazole also increases your risk. Opiates increases your risk, and benzodiazepines. So there's 5 distinct different types of medications that increase your risk of getting Alzheimer's or dementia, especially if you're taking these drugs on a daily basis. Now, the first 3 that we're talking about, the anticholinergics, the antihistamines, and the omeprazoles, those are over-the-counter medications that you can get. The opiates and the benzodiazepines, of course, those are prescription medications, and so it is definitely not my place to tell you to stop taking a prescription medication. But I do want you to know what those medications are so that you can have a meaningful conversation with your doctor to find out if there might be better options for you. So again, in the anticholinergic medications, most of the time you're going to see an anticholinergic over the counter in one of the sleep aids. Let's say you might be taking Tylenol PM. You might be taking Excedrin PM. You might be taking something like Sominex or ZQuil, or again, anything that's going to help you to be able to sleep has a medication in it called diphenhydramine. And that diphenhydramine, not only is it an anticholinergic drug, it is a high level anticholinergic drug, meaning that its regular use has a high probability of increasing your risk of Alzheimer's or dementia. And so again, if you're taking a sleep aid over the counter, it's important to be aware of that. Also, it's important to know that Benadryl and Dramamine, they fall into a double category because Benadryl and Dramamine fall in the category of an anticholinergic and an antihistamine. And it used to, again, nobody used to think in not that long ago about the risk of antihistamines as it related to increased risk of Alzheimer's or dementia. So again, if you're taking Benadryl on a regular basis because you're thinking, oh, I can't sleep well, and I know that if I take Benadryl, it will knock me out. Again, think about the ramifications that that's going to have long term. Now, if you're using Dramamine because of motion sickness, and oh, you're getting ready to go on a cruise and enjoy a 1 week cruise, a 2 week cruise, using Dramamine in short little spurts is probably not going to be a problem, but it can be a problem if you're taking Dramamine and you're taking some of the other medications we're going to talk about, because then the compounding impact is what can be very, very problematic. So again, so far we want you to be thinking about over-the-counter, if you're taking any of those sleep aids, ZQuil, Tylenol PM, Excedrin PM, Anacin PM, any of those medications that have the letters PM, Unisom, any of those things, be very, very mindful of them. And if you're taking Benadryl and Dramamine, be very mindful of those, especially if they're compounded with some of these other drugs we're going to talk about, medications. And so omeprazole, and you might know of omeprazole as Prilosec. And there's other, let's see, what other things might, oh no, Prilosec is probably the one that you're going to be the most familiar with. And so omeprazole, Prilosec, is for people who have been told that they have too much acid. So they might have some GERD, some heartburn, some indigestion. So they take Prilosec to calm down the acid production in the stomach. And so that might seem like a good idea if you've got some heartburn and some indigestion. But the sad thing associated with that is that omeprazole suppresses the production of vitamin B12, or it suppresses the absorption of vitamin B12. So why would you care about something that suppresses the absorption of vitamin B12? Well, the problem with that is that a B12 deficiency actually mimics Alzheimer's or dementia. So you can be unwittingly doing things to give the impression that you've actually got Alzheimer's or dementia, when what it really might be is just a B12 deficiency. So again, omeprazole, Prilosec, suppresses B12 absorption, mimicking Alzheimer's or dementia. So taking that day in, day out is going to, for certain, have an impact on the cognitive health of your brain. Now, when we think about things like antihistamines, and we talked a bit about the Benadryl and the Dramamine because they fall in the antihistamine and anticholinergic family. Well, other antihistamines that you might be taking every single day because it's available over the counter are going to be things like Claritin. That's a sandhill crane flying above, if you're wondering, what is that sound? Anyway, sandhill cranes are beautiful, and they are everywhere here in Florida. But to get back to your antihistamines, things like Claritin and Zyrtec, again, over the counter, and so if you struggle with allergies, so you're taking Zyrtec and Claritin every single day, it can be very impactful to the health of your brain. And what's really important to know is that these two antihistamines in particular were created as a second generation antihistamine because in the past people were concerned about what Benadryl, because Benadryl again had the impact as an even though it was initially used as an antihistamine, they realized, ooh, that's got some anticholinergic properties and that can hurt the brain. So they came out, they made Zyrtec, Claritin, thinking, oh, this is a second generation. It doesn't have any anticholinergic properties. We're going to be safe. Then sadly, the study came out in 2024 that said, oopsie, we weren't thinking about the fact that people are going to be taking these medications every single day and what the compound of that would be. So now they've retracted the safety of the Zyrtec and the Zyrtec and the Claritin to say long term it really does have impact on the brain. So again, it's important if you're taking these medications every single day, maybe think about other ways that you can help work on any kind of allergies that you might be struggling with. Sorry about that. Now, to get to opiates. And again, remember, I am not a prescribing physician, so I'm not telling you to go off of your opiates if you're on them. But I'm saying please have a conversation with your doctor about opiates. And I hope the screen is, well, you probably see my little girl, Dot, is trying to come and say hi as I'm filming. But anyway, so when we think about opiates and we're thinking about things like, oh my goodness gracious. We're thinking about things like hydrocodone, oxycodone, those kind of medications. Again, if you're on them, you might want to talk to your doctor about what other medications might help with pain management. And why are the opiates a problem? The opiates are a problem because, excuse me, long term, these opiates cause the brain to actually shrink. And nobody wants their brain to shrink. So again, be mindful. If you're taking the opiates for a short window of time, let's say you've had surgery and you need some pain management for 7 to 10 days post-surgery, okay, that makes some sense. But to be on it long term, again, we now know that opiates long term actually shrink the brain. And then when we go to the benzodiazepines, so when we're saying benzodiazepines, we're thinking about medications like Xanax and Valium. And Xanax and Valium are really great because they enhance GABA production. And GABA is a neurotransmitter that helps you to feel chillaxed. Hence, that's why Valium and Xanax work so well, because they just help to take the edge off of the world. And again, short term, that's wonderful. Let's say you've had some significant emotional trauma that's come your way. It might be the loss of a parent. It might be the loss of a job. It might be the loss of a marriage. Something that happened that just shook you to your core. And you need something to help you to handle that. So again, short-term use is great, but then when people start taking Valium every single day or take Xanax every day, and you think, well, okay, well, it's just helping our body to make more of that GABA to keep us calm, that's great. But again, the studies, and I'm looking at my cheater notes because I took a lot of great notes here. But long term, when GABA is activated all of the time, then it actually ends up suppressing brain activity. And so when brain activity gets suppressed long term, that means cognitive decline goes up and memory loss goes up. So again, if you're taking a benzodiazepine long term, please talk to your prescribing physician to find out what things might you be able to use in place that will allow you to handle the stress or the anxiety effectively, but not impair brain function. So again, I am going to link the other videos I did on the anticholinergic drugs in the past. Because again, we used to just think about anticholinergic drugs and their risk for Alzheimer's and dementia. but we weren't thinking about the second generation antihistamines. We weren't thinking about the omeprazoles. We weren't thinking about the Xanaxes, the Valiums, and the opiates for what it was doing to the health of the brain long term. We're watching Alzheimer's and dementia skyrocket around the globe. But it's important to know, again, there are things you can do to stop and reverse your risk of getting these diseases. You just have to know what to do. So again, in the show notes, I'm also going to have a link to the website, because on my website there are so many free resources. We've got a vitamin guide that will tell you what are the vitamins that you can take to enhance optimal brain health. There's a better brain meal plan that will talk to you about what are the foods you should eat more of to make more brain cells, so that, again, if you're on some of these medicines, and these foods can help to balance out the counter effects of some of these medicines. So please go over to the website. I'll have it linked so that you can get a hold of the free resources, because once that brain gets to a certain threshold, it's very difficult to turn that ship around. And I want to help you to stop your course now and turn it around so you can do everything in your power to improve the health of your brain. And if you found this information valuable, please, please, please share it with your family and friends. Again, there are great resources out there that can help save your brain. But you can't save your brain if you don't know what those resources are. So please hit that like and subscribe button. Again, share the information with your family and friends. And I look forward to seeing you next time with a better brain tip. Take care. See ya. Bye now.